Disease Branch of the Center for Health Protection, and Dr. Linda Yu from the Hospital Authority. We'll first hear from Dr. Chang. Last night, there has been 8 confirmed cases, number 11697 to 11704. 2 males, 6 females, aged between 2 and 57 years old. 3 of them are imported cases. 11697 flying UK 6395 is a 2-year-old boy. Previously, a family member of his has been confirmed, so he is in the quarantine center. So far, 53 confirmed cases were from this flight. Some were picked up upon entry into Hong Kong. A lot of them felt unwell, or they are the 12-day sample at the quarantine center. 11698 is a 38-year-old female arriving from the Philippines. Is arriving on the 6th of April, flying with EJ 5J272. This is also N501Y. It's a 12-day sample. So far, there are 230 cases of N501Y variant strain, of which 99 cases are the UK ones, 34 are the South African ones. The others are waiting to be screened or are undetermined. 11699 is arriving on the 18th of April, flying with UK 6397 from India. It's a 2-year-old girl. Family members also confirmed. There are 5 other cases. 4 of them are local cases. 1 is to be classified. First, the local cases. The first one is 11700. It's a 57-year-old female living in Belvedere Garden, Phase 2, Block 4. At Sa Choi Road, Tat Mau Zhong Sam is the location where she worked. There are 2 or 3 other staff members. They're all in quarantine center. Last day of work is the 12th of April. On the 16th of April, she had a sore throat. She went to see a private doctor and left a deep throat saliva sample. Is later confirmed. At one point, on the 11th of April, with a number of friends, she went to 33 Cameron Road in a restaurant called Lo Gun Gam. There are altogether about 10 people in separate tables, herself and family members. So quite a number of them have been sent to quarantine center. She's been to Meifu, a Shanghainese restaurant case, a restaurant, and also in Tsuen Wan. The other case is 11702. Someone coming back from under the scheme, Return to Hong Kong scheme. 46-year-old female living in Castle Peak Road, Sun Ting Dai Ha in Tsuen Wan. On the 6th of April, via Shenzhen Bay and via Tong Mun, she came back to Hong Kong. She's been living in Dongguan for about a year. On the 10th, between the 10th and the 19th of April, she went to Nina Hotel at Tsuen Wan, working as a chambermaid. Last day of work was the 19th of April. Her co-workers and relevant residents of those rooms she worked in are all sent to quarantine center. With a number of friends and family, she went to Sam Sing Chun. Guangdong Mingmun is a seafood restaurant, and Gai Gei roasted meat restaurant called Ga Gei in Tsuen Wan. She had meals. After the 6th of April, after she's arrived in Hong Kong, she's been quite active. So we think that it is very likely that is a local case. 11703 is a 41-year-old male living in Mei Tin Estate, Mei Ting House in Taiwan. He's a construction site worker working at Luen Phuc Road number 30. So relevant workers at that site will have to go through compulsory testing. Those who share the same workplace, a number of them will have to be quarantined. He is asymptomatic. He's been regularly tested. Last test was done on the 10th of April. This time is the 17th of April. In the infectious period, he's been to a number of restaurants. Long Sun Hien 海鮮酒家 in Taiwan, Ming Gei in Jordan, Bak Mei Gok and Gam Gei in Kowloon Tong, Daniels and Tao Hung, and McDonald's at Taiwan Road, and a number of other restaurants. He's visited relatives who lived in Hau Tak Estate. The fourth local case is 11704, 29-year-old female. She is an Indian foreign domestic helper. On the 18th of April, the sample was positive. During the incubation period, she was staying in Hong Kong, but on the 20th of March, she arrived from Indonesia, flying with SQ882 between the 20th and the 29th and the 20th of April, 20th of March and the 9th of April. She's been staying in Ramada Hotel, Hong Kong Grand. The hotel itself is subject to compulsory testing. When she returned the residential flat, she lives in Yong Lai House, Yao Lai Estate with her employer. After leaving the hotel, she's been to Lei Yun Bun Market, Lam Tin Shopping Mall on the 11th of April. At Itamomo, she ate. The CT value is rather high. She stayed at Ramada Hong Kong Grand in Tsim Sha Tsui. She stayed at the same floor as the case from Dubai, the case with N501Y variant. So she had to go through compulsory testing. We are trying to investigate into possible cross-infection. We will conduct genetic sequencing analysis to see if they share any similarities. There is one unclassified case currently. It's 11701, 56-year-old female, living in Fu Yong Building, Fu Yong Street, Chun Wan. Is a subdivided unit. Living with her is a family member and another 10 to 20 tenants in other subdivided units. She's actually under home quarantine on the 6th of April via Fujian, Shenzhen Bay. She arrived in Hong Kong. She arrived in Hong Kong at about 5 p.m. And the other one arrived in Hong Kong at about 2 p.m. under the return to Hong Kong scheme. So there was no contact between these two cases. Upon arrival at Hong Kong, she's been living in that unit I mentioned with a family member. Sometimes with friends, she would go downstairs to nearby market and 7-Eleven. The friend and other tenants of subdivided units are all sent to quarantine center.
Well, this person has never left the address. It is likely that it is an imported case. However, it is also likely that it is a local case because there are other family members moving in and out. So we have to wait for the results before we can classify that. And if we can conduct genome test, it would be even better. We haven't classified this case in Fujian, we haven't heard any particular cases. We have checked the wristband during the quarantine period. There is nothing out of the ordinary. And this is the 12th day sample. The earlier samples came back negative. Having got these 5 cases out of the way, I'd like to bring you up to date on the earlier investigation of Ramada in 11643, the one with N501Y strain, the one that we pick up from the community, that gentleman. The genome analysis showed it is a South African variant strain. There are 3 possibilities. Imported case, maybe a very long incubation period and the virus wasn't picked up, or it is likely that after he arrived in Hong Kong, he picked up the virus in the community. The CHP and the EMSD and Buildings Department have paid a visit to the hotel where he stayed to look at the air conditioning and the piping and the drainage system. There is nothing out of the ordinary regarding the piping and the air conditioning system. On the same floor, there are 2 positive cases that overlap with his period of stay. For these 2 cases, they also carry the South African variant strain. There are 8 or 10 cases on the same floor, but they carry N501Y, but not the E484K. On the same floor, there are 2 others that carry N501Y and E484K. Both are African variant strains. One is next door, the other one was further down or diagonally across. When we conducted the site visit, we looked at all the possible routes of transmission. It is unlikely that they got into touch with one another. The only chance of cross-infection was during the meal delivery. In the hotel, there is the S-shaped hook on the handle to facilitate the hanging of plastic bags to facilitate delivery of meals. And the occupants would hang the lunchbox on the hook after they finished. We suspect that hook is likely to cause some cross-infection. It is not easy to clean, and there is a likelihood that cross-infection might take place through the hooks. The Public Health Division conducted a genome sequencing on these 2 cases in 11643. So the genome sequencing results are pretty similar for the 3 cases. So 11643 could have picked up the virus in the hotel. We cannot rule out this possibility, although the possibility is pretty high. Now we have identified the hanging hooks as the possible route of transmission, and the hooks have been removed, and the handles have been thoroughly cleansed, and there are anti-infection measures implemented. The one who was living with 11643, the lady, prior to hospital admission, it was 30 for the CT value, and after hospitalization, it was 20 or something, and there is no antibody to speak of. So it is likely that it was a newly acquired virus. So it is unlikely that she infected 11643. So much for me for the time being. Dr. Yu, Hospital Authority, please. As of 9 a.m. this morning, over the past 24 hours, the Hospital Authority reported 11 cases. As at 9 a.m. over the past 24 hours, 13 more confirmed patients have been discharged. A total of 11,286 have recovered and been discharged. 169 confirmed patients are scattered in 17 hospitals and also the North Lantau Hospital. 3 are in critical condition, 4 in serious condition, 162 in stable condition. Negative pressure bed 1169 or 59.1% utilization. Negative pressure ward 65.3, utilization 70%. As of 23rd of April, the Hospital Authority will increase 3 more outpatient clinics to provide Sinovac vaccination. That's in Sao Kau Wan General Outpatient Clinic, Hong Ham Clinic, and also Robert Black General Outpatient Clinic. Starting from 9 a.m., members of the public can make booking through the COVID-19 vaccination website. If I may add a little bit here. Now, for the building subject to mandatory testing, we have completed the compulsory testing today. We have the Yao Lai Estate, Yong Lai House in Yao Tong, and the workplace is Lina Hotel, and there is a construction site that I refer to. The people there will have to be subject to mandatory testing. As to N501Y11643 and his friend, the places that they have been, we have conducted testing there on the 7th and the 14th day. For precautionary measures, the relevant people will have to be subject to testing again. I now throw the floor open for questions. Please identify yourself, and the gentleman over here, please.
Pose 3 questions. First is about the Ramadan Hotel in Tsim Sha Tsui. What sort of action will the health authorities take? For example, do you think that it's time perhaps to evacuate everyone who is currently staying in there? And in fact, the other question is also about this hotel. Media reports have suggested that many of the patients with the mutant virus were people who stayed in the hotels under the same brand, the Best Western brand. So my question is, will the authorities look into the hygiene standards of all the hotels under this brand? Because some of the other hotels are also, as far as I understand, are also quarantine hotel. And then the last question is about the 2 people who were confirmed infected upon arriving in Hong Kong from mainland China. Do you think that it's time perhaps to restrict people, be they Hong Kongers or mainland Chinese? Is it time to restrict them from entering Hong Kong for now, because we're having 2 cases today, and would there be any more cases to come? Thank you.
For the updated investigation concerning the 11643, so far we have not identified other environmental factors causing possible cross-contamination or cross-infection among the cases. But we identified there were 2 cases on the same floor where the 11643 has stayed, and genetic sequencing, the whole genome genetic sequencing conducted by the Public Health Services Laboratory branch has shown that they are highly similar. So the environmental investigation identified there's a hook at the handle of the door, for hanging the lunchbox for the residents in the hotel. So this has been immediately removed in all designated hotels, this practice. And we have taken some swabs of those hooks we can get hold of, and all were negative. And the ventilation, the drainage pipe at those hotels, no obvious abnormalities have been found. So I understand our infection control colleagues has advised a step of infection control measures to prevent any cross infection among the residents. So far, we have identified, in the Tsim Sha Tsui Hotel, we identified around 10 cases since January from this hotel. We have sent all this, specimens for further genetic sequencing to identify if there are other cases similar. If there's any identical sequencing coming from this hotel to compare whether there's other possible clustering. And as a precautionary measure, we have quarantined all those residents who have stayed in the same floor of that hotel during the period from 19th of March to 9th of April. During the whole period, if they had stayed in the same floor of these 3 cases, into quarantine for 21 days, just in case they were exposed to the same risk as the other patients. So for the 2 cases coming from mainland today, one is possible. One is he's working in Hong Kong after she arrived, and has been exposed to various places and staying in Tsuen Wan. So we manage as a local case at the moment because she has quite a number of activities in the community. And for the other one who was staying in the home quarantine, we have quarantined all the other residents in the same flat. We have also notified the mainland China for both cases for their investigation whether there's any possible, in case there's any possible source of infection in their places as well. So we have not yet classified this case pending further investigation. Yeah. So, of course, we have to identify the source of infection first because we have no evidence of that they are imported from mainland at the moment.
下一位，嗰邊第三行嗰位男士。
The gentleman over there in the 3rd row. I'm from Citizens News. I'd like to ask about 11701. Do you know if that lady has been vaccinated? Vaccine from Sinopharm? If she has, can you give us more details? From the information supplied by the patient, she has had 2 doses of vaccines. I'm not very clear about which one it is, because one dose was administered on the 19th of February, the other one 19th of March. The lady over there on the outside. Your organization, Ming Pao. Dr. Zhang, you mentioned about the Indian guy with a variant. On the same floor, there were 2 cases of South African variant. Can you give us the case number and from where they arrived? 11754. 11704, you said that the Indonesian maid has stayed in the same hotel. Any possibility that is related to the Indian guy and the other 2 cases? Have they shared the same lift? Or they've used the same lift shortly after one another? Has the same S-shaped hook been used on different floors? Is that a possible infection path? 11672, that is the female friend of the Indian gentleman. So far, you don't know whether she carried any antibody. Is she of Indian ethnicity? Apart from working at a clinic, where else has she been? What are her whereabouts? Have you traced the number of people who have been to the clinic and sent them to quarantine? I'd like to also ask about Ramada Hong Kong grant. Would you require employees of the group to get tested for antibodies because they might have been infected? However, there is no symptom, so they might have developed antibodies already. Your first question was about the case number of the 3 cases. 11550 and 11544 share the same floor. One's from the Philippines, the other one's from Indonesia. 11704. Our preliminary investigation shows that it's a different floor, and each room will have their own hook. They're not swapped or changed. There are a number of confirmed cases from this hotel. All those confirmed cases from January will have to go through genome sequencing to see if they share any similarity. For this particular hotel, and of all the confirmed cases, there are only 3 cases, these 3 that carry the South African variant. The others might be variant strain, but none of them are E484K. Of course, we can't rule out the possibility that is related to other hotels or other floors. Currently, it is not easy to carry out analysis because the CT value is close to 40, so the viral load is rather low, maybe too low for us to carry out any analysis. In relation to hotel employees, they are subject to a test once every 7 days. We've conducted another round of testing. They are all negative. We have no plans to test for antibody because even if we do so, it's difficult to tell whether they are infected from the hotel, from the community. We are unable to carry out genome sequencing analysis to see if it's related to that case. Next question.
HK. The first one is how can the hook cause cross infections in the Tsim Sha Tsui hotel? Like, how can the virus attach on the hook? And the second question is, can we say that the cases with unknown sources have already widespread in other districts? And are we seeing a gradual loss of control of the pandemic? And is this related to activities and relaxation of measures in the long Easter holiday? And the third question is, how many confirmed cases have taken Sinovac and BioNTech jab so far? And do we have the exact numbers? Thank you.
What exactly happened causing the 3 patients with highly similar genetic sequence and the clustering in the same floor? I mean, we do not know exactly what happened, but we only identify there's a risk in the hook, in the handle, because there's a S-shaped hook at the handle of the door. So the restaurants, the hotel staff will put a plastic bag with the lunchbox on the hook. So in case, and the resident will take the food from the hook. So in case the hand of the resident is a case, I mean, he carried the virus, she might contaminate the hook. And after he get the food and replace the food after the empty lunchbox in the same place. So in case the staff get the get the bag again there and followed by the another room, he may carry the virus around. Although usually the staff will wash their hands before and after finish the job, so the staff may not be affected. They may mechanically carry the virus around. So this practice is just identified as a risk factor. We cannot prove this. I think it's more or less the time after the Easter holiday, because the long holiday, the silent transmission in Hong Kong has never been stopped before the Easter holiday. So probably after the mixing and the social activities during the Easter holiday, we are seeing more cases locally. So hopefully, we are tracing every case diligently and try to limit this spread as much as possible. So hopefully, we still need to monitor for a few days. Yeah. As far as I can recall, there's no fully vaccinated. In Hong Kong cases, there are no. For what we mean fully vaccinated is 2 weeks after the second jab. So we have not yet received any cases who have received either Sinovac or BioNTech in Hong Kong.
好，下一位，嗰邊第三行黑色外套嗰位女士。
The lady in black jacket. Cable TV. Fu Yong building. That lady there. What is the source of infection? Is it the case that some cohabitants were bringing the virus in? There are 4 local cases of unknown source. Why is it there are so many unknown cases of unknown sources? Has it got anything to do with the Easter holidays? The Fu Yong building case, she's never left her home. She was a confinee. She was confined for home quarantine. It is a subdivided flat that she's living in. There are a dozen or so tenants in the same flat, and they may be moving in and out. And this may be a source of infection, but still we have to wait until they have been fully tested and see whether there are any positive cases. The other possibility is that she wasn't in town for some time. Is it an imported case, or is it a local case? So for the time being, it is still indeterminate. We see a surge in the number of cases every other day. It is about time after the Easter holidays. Now, during the holidays, and there were more mixing, there were more activities. And the silent transmission has never stopped, albeit at a pretty low level, with more social mixing. Obviously, there would be more cases coming up. Speaker not coming through. For that case, we classify that as a local case because the person has left the hotel for some time and the CT value is pretty high. It all depends on the condition after hospitalization. Why do we have to test? Because there is a compulsory testing for the entire hotel. Everyone in the hotel where the patient has lived will be subject to compulsory testing. Whether it was a confirmed case, and when the person came to Hong Kong, the viral load was a particular low, and the test didn't pick it up. There was a possibility that the person has been in the community for a dozen or so days, and he has been out and about. Whether he has picked up the virus in the community, we're not sure. There is another possibility that because of the S-shaped hook, the infection occurred there in the hotel. Now we have to look at all these confirmed cases. We will analyze all the genomes to see whether there is any connection. The lady over there, please. Hong Kong 01, 11702. Now she came back to Hong Kong on return to Hong Kong scheme. Has she been vaccinated in the mainland? There were some who could come to Hong Kong on fake documentation, like negative documents. How risky is it if they come to Hong Kong using these kind of documents? So you have to subject them to testing to ensure security and safety. 11704, she stayed in Ramada Inn, and there may be problems with the air-shaped hook. Are there any other quarantine hotels that are using these kind of hooks? Would you advise them against using this? Third, how many preliminary positive cases are there today? 11702, she hasn't been vaccinated. On the 7th of April, she has undergone testing after coming to Hong Kong, and the test came back negative. This is the 12th day that the case was picked up. Now, even for those coming back on a return to Hong Kong scheme, testing will still have to be done. As to the hook, other than the Tsim Sha Tsui Hotel, and other Ramada Inn hotel also use these kind of hooks. So we have advised all the quarantine hotels against using these kind of hooks. It's far better for them to use a stool, but the corridors are pretty narrow, and it would be hard for them to use a stool, and instead they use a hook. But we have asked them to step up the anti-cross-infection measures. The best course of action is to do away with the hooks. There are no preliminary positive cases on my way here. The gentleman over there, please. AM 730. 11704. Has she been tested for N501Y? Is she in any way related to the Yau Tong outbreak? And is there a new chain of suspicion in Tsuen Wan? Why is it that all these cases are breaking out in a particular district? 11702, that cleaner, how many rooms has she cleaned, and how many occupants have to be subject to quarantine? And for those who stay only one night, would they be subject to quarantine? 11701, is her friend at work, and what are the risk factors involved? 11704, the viral load is particularly low, and we couldn't conduct any genome testing for N501Y. However, the lab will have another go at it and see whether they can collect any sample from the hospital. If there are positive samples, they can conduct further testing. It's hard to say whether there is an established link with the one in Yau Tong. In Tsuen Wan, there are 3 cases from Tsuen Wan, so it is likely that there is a chain of transmission there in Tsuen Wan. But even in Tsuen Wan, we have conducted a lot of mandatory testing. We didn't pick up a lot of cases. District-specific transmission is pretty common. When you walk down the street, you may take public transport, and you may go somewhere which is pretty difficult to trace, and we're not sure whether there is any transmission there.
11702. She's responsible for about 10 or 11 rooms. She worked with about a dozen or so other people. It's an untraceable case. So we will count back 14 days before she's confirmed. There are about 43 people who stayed in the room she's responsible for. They have to go to quarantine. Those include those people who stay there for staycations. 11701. The family member, well, that is the friend who lives with her, is currently unemployed. There are about a dozen or so other people living in the same unit. We don't have any information yet. Sorry, speaker's off mic. The speaker is not using a microphone. The interpreter cannot hear. Sorry, the speaker is not using a microphone. The interpreter cannot hear. The second day sample is negative. Of course, we have notified Guangdong province and mainland China. They've conducted vigorous testing and investigation to see if there are related cases or a possible source. Of course, we have to do what we're supposed to trace the source of infection and possible transmission in Hong Kong. We have no suspicion that the sample given from the mainland is fake. The lady in the middle. Please tell us your organization, TVB. Well, there is a case under return to Hong Kong and local cases. Can you briefly tell us which ones are untraceable ones? Apart from Ramada hotels, have you checked other quarantine hotels if they've used a similar S-shaped hook? Would you advise that this kind of hook is not to be used? I'd like to ask about Nina Hotel. There are 43 customers involved. So will other visitors have to be sent to quarantine? Once we've had that finding in relation to the hook, we've informed all hotels to not use that kind of hook. They will not be used again. It's not just for this period of time. There are 4 local cases including 11700, 11702, 11703 and 11704. 11701 is currently unclassified. 11702 is a case under return to Hong Kong. However, she's been quite active in Hong Kong and she works in a hotel. So it's currently classified as a local case. Nina Hotel. The period is mainly it's a 17th days. It's 17th of April sample that is positive. So we will cover people who stayed in the rooms that she's responsible for. She's cleaned about a dozen rooms or so on the 42nd floor. The gentleman over here. Yes. Unrelated. Speakers off mic. The interpreter cannot hear. One 11544. Next, the report in blue. I'm from Hong Kong Economic Times. Dr. Chang. The S-shaped hook at Ramada Hotel. How can it be cross-infection? Because you said that it's not changed or shared. There is now a risk of cross-infection at Ramada Hotel. Would you advise the hotel to suspend operation of that floor and conduct a thorough disinfection? Disinfection and cleaning, of course, has been done once we have known about the case. We can't be sure whether the hook is the source of infection, because those staying in hotel rooms do not come out. The only path that can be the source of cross-infection apart from the hook is the drainage system. We have looked at that and we have not identified any irregularities. So the only way which is a possible cross-infection path is the hook used for hanging the meal boxes at the door. Well, the meal box is put there, and then someone from the room will have to take it. If there is virus on the hand, then the virus may be transferred onto the hook. And if there is virus on the hook, then next time when the person delivering the meal box may touch the hook and pick up the virus and then transfer the virus to the next hook. And then the resident in the next room may get the virus from the hook. That is the only possible object that might be indirectly shared. So you have to be very careful. The employees are very vigilant and careful. They will clean everything they've touched to reduce the chance of cross-infection in the future. The lady at the back. I'm from Now TV. Can we understand that to be 5 untraceable cases, 11700 to 11704? Well, did 11701 return to Hong Kong under the Return to Hong Kong scheme via Shenzhen Bay? Or is 11702 the only one under the Return to Hong Kong scheme? You just now mentioned that there may be hidden transmission chains in Tuen Mun and Tsuen Wan. At Oi Fai House, Tuen Mun, there was a confirmed case, a gentleman. Was he infected because he was on the same floor? Can you confirm that? 11701. It was a case confirmed during quarantine. The family member is not yet confirmed, so you can't classify whether it is a local case or an imported case. Can you give us more information as to where is more an imported case or more a local case? 11701 arrived in Hong Kong using the express rail from Fujian. It's not a Hong Kong resident, so she can't use the Return to Hong Kong scheme. Upon arrival, she's been put under home quarantine. For the Oi Fai House case, is the next door neighbor of a previous confirmed case. That doors are very close. They know one another. They would greet one another, but they have not been to each other's places. So there is a chance of environmental infection. Well, we have identified a similar risk at other locations in the Oi Fai House, so we sent those who are living on the 8th floor of Oi Fai House to the quarantine center for safety. We identified more cases in Tuen Mun and Tsuen Wan. As to the exact transmission chain, we are currently not any wiser. For 11701 is currently unclassified. On the 17th of April, she started to have a sore throat, and on the 6th of April, she arrived in Hong Kong. For most of the incubation period, she was in Hong Kong, but there was a time when she was not in Hong Kong. And as to whether it is a local case or an imported case, currently we are unable to tell. Well, that's the end of today's press briefing. Sorry, speakers off mic. The speaker is not using a microphone.
We haven't got the accurate genetic test. It is likely that it is E484K. Thank you all very much. Occupation, unemployed. CT value, 30 plus. There are 3 in North Point. There are 2 who are living together. According to Hong Kong U's genetic analysis, they are similar, like the one in Tsim Sha Tsui. They are living in opposite, across one another. They're side by side, basically. From the environmental analysis, we haven't picked up anything unusual, but they also use the hoax. Maybe there was this can be attributed to this factor in terms of cross infection.